Hello, my name's Emma and my background is naturopathic and homeopathic practitioner, and I've done doula work, and I'm also a meditation and relaxation teacher. And today I'm going to do a talk on the top 3 homeopathic remedies to use in preparation for labour and birth. Homeopathic remedies have been used for many years to assist women during pregnancy, birth and the postpartum period. And they're generally non-toxic, have low risk of adverse effects, and especially when prescribed professionally, they can sometimes provide some outstanding results. However, they can still also be used in a first aid kit for the home prescriber. Especially during labour can be a very sensitive time, so caution in overdoing homeopathic remedies, especially when it hasn't been prescribed for you. However, I'm going to give a description of my top 3 homeopathic remedies that can be used to prepare for labour and birth. My number 1 remedy is Arnica. Arnica is a very popular homeopathic remedy in all first aid kits, and it's probably the top remedy I'd recommend for a pregnant woman to have in her first aid kit. It can be used for healing any trauma and bruising, which obviously can result from a birth, whether it's a normal birth or whether it's a instrumental or surgical birth. There's usually some sort of trauma in the perineum or the surgical incision area. Arnica could potentially be used starting week 38 to assist a woman to prepare for her labour and the trauma that's going to happen to her physical body. Perhaps you could start taking it once a week after week 38, and then the closer you get to birth, you could potentially increase it. So maybe week 39 you could take it twice a week by the mouth. And then with impending labour, you can increase the dose. As soon as you notice labour starting, you can take a dose, particularly if you haven't taken it for a while. And then perhaps, depending on how it goes, you could take it every 2 to 4 hours during the labour if you're in a lot of pain. During the labour, it can potentially help, as I mentioned, with some pain relief, and it can also heal any injuries to the tissue, particularly where there's a lot of bruising. And it could also potentially help prevent hemorrhaging, which can happen as a result of the trauma. There are other remedies used for pain, hemorrhaging, and other results of birth. However, Arnica is one of the top remedies, and I highly recommend it to be in your first aid kit for pregnancy and birth, for postpartum, and also to help with any trauma and injuries that happen as your baby starts to grow up. The second remedy that I recommend for your homeopathic birth kit is phos. Phos is a remedy for all spasming pains, particularly when you feel like you need to bend over and double. You might hug your knees towards your chest or lift them further towards your chest. And you might prefer to put warm packs on the area where you're having the spasm, the contractions. Also a good period pain remedy for that type of period pain where you do have that doubling, shooting sort of pains. And again, you could potentially start taking an occasional dose of phos prior to the birth. So say week 38 or 39, you could potentially start taking it once a week, and then maybe twice a week when you reach week 39, and then on impending labour you could potentially take it every 4 hours, particularly if you are getting that doubling sort of sensation where the pain gets quite shooting, and you might even put the warm packs on your body. The third remedy that I highly recommend for a homeopathic birthing kit is Caullophyllum. Caullophyllum is traditionally used as what's called a partus preparator, which is a remedy that helps a woman prepare for labour. And the Caullophyllum is used to help bring on the Braxton Hicks contractions if they're not often and strong by week 38. Again, initially you might only take it once a week, and if by say week 39 the Braxton Hicks contractions, the little preparing contractions, are not often and strong, you can take it more frequently, so maybe twice a week or 3 times a week even. And it is one of the remedies that can be used during labour, particularly if there's no progression of the cervix. So your cervix needs to dilate in order for the baby to come out. And sometimes there can be what's called failure to progress. So in this case, a dose of Caullophyllum can sometimes get the cervix to dilate. However, single doses are preferred, as overdosing can do the opposite and lead you into getting cesarean, because it can cause the contractions to go really strong without a cervical dilation.